Hello, everyone, and welcome to the CARE Challenges and Solutions for a Sustainable Future Conference, Week 3. My name is Sue Yendall. I'm the Professor of Sociology and Director of Circle at the University of Sheffield in the UK, and I'm the Principal Investigator for the Sustainable Care Connecting People and Systems Research Programme, which is the organiser of this conference. It is my great pleasure to introduce our keynote speaker, Joan Tronto, who is Professor Emerita of Political Science at the University of Minnesota. Joan's PhD is from Princeton University in the USA, and in a career of great distinction, Joan has been Professor of Political Science at the City University of New York between 1996 and 2009, and since 2009, she has been at the University of Minnesota, where she was made Scholar of the College between 2013 and 2016, a prestigious appointment. Joan has also held important visiting positions in many parts of Europe. In France, she has been visitor at the University of Paris 8, and she's also published in French. In Germany, she's been a visitor at the University of Göttingen, in Italy at the University of Bologna, in Germany at the Goethe University, and in the Netherlands at the University of Utrecht. And of course, Joan has also held visiting positions in the USA at Yale and at the University of California at Irvine. Joan's exceptional contributions to scholarship and the progress that she has led in global thinking about care are familiar, I think, to us all, but we all know we have much more to learn. Among many other publications, Joan gave us Moral Boundaries, a political argument for an ethic of care, which she published in 1993, and later Caring Democracy, Markets, Equality and Justice, which has been widely read and was first published in 2013. Joan has also published numerous important articles in many academic journals, far too many to list today. In 2015, she generously agreed to support the development of a new journal, the International Journal of Care and Caring, which with others I was then developing by becoming our consulting editor for North America. Joan wrote a special article which has proved very influential for the International Journal of Care and Caring's very first issue in March 2017. And she called it, "There is an Alternative, Homines Curans and the Limits of Neoliberalism." Joan has been a stalwart supporter of the journal ever since and is currently guest editing with Professor Michael Fine from Macquarie University in Australia, a special issue of the International Journal of Care and Caring on COVID-19. Joan supported the launch of the International Journal of Care and Caring in San Francisco in 2017, when she also took me to my first ever baseball game at the famous Oracle Park Stadium, an experience that I and Joan's other guests will never forget, and a great evening. Joan kindly visited the Sustainable Care Programme team in 2018 to give a guest lecture at the University of Sheffield, and she also took the time to meet with the Sustainable Care team and to discuss their work with our postdoctoral researchers and our PhD students, and we were very grateful for that opportunity. It is my honour and our privilege to have Joan here today, live from the USA, to give a keynote address from which I know we will all gain much to think about. Joan has chosen as her topic, Ending Wealth Care, the Future of Caring Democracy. Joan, welcome. The floor is yours.
Thank you, Sue, for that really lovely introduction. And in general, I want to thank Sue and the organizers of the conference, Kelly, Denise, and the entire Sustainable Care community at Sheffield for their work in organizing the conference, which has been wonderful, and to organizing my speech there. I'm going to dedicate my talk today to the memory of Elena Pulcini, a philosopher, scholar of care ethics, who passed away on 9 April from COVID in Florence. So, next slide. There's something we all know, which is that even before the global pandemic, it was clear that care structures were inadequate to meet the present and future needs of care. This is not only because of demographic changes in population all around the world, but also because of the ongoing devaluation of care work, which has led to care shortages everywhere, and even the patches that we've been using to subsidize care in higher income countries by importing care from lower income countries, it's just clear that the global international division of care labor cannot meet the caring needs that exist. Now, COVID-19, for more than a year, has operated as kind of a stress test for global sustainable care. And what's become clear to everyone, I'm sure, who's listening, is that we're failing at this test. Next slide. And furthermore, next slide. Okay. Furthermore, we're not surprised about this failure. Next slide again. I want to start at the end by saying we can already imagine what a care economy would look like. And in just the last year, although back in 2013, Carrasco published a piece in Spanish about care as the spine of a sustainable economy, people have been talking about care economy. The term has shown up on the op-ed page of the New York Times twice in the past month. But Oxfam published their report, Time to Care, before the pandemic broke out early last year. UN Women, in its annual report, focused on the needs of care. Also, a group of Austrian and German-speaking scholars of care have produced a wonderful webpage called Care macht mehr, Care Makes Better, and they've updated it to make it clean up time, redesigning care after Corona. You probably know the Women's Budget Group of the UK had commissioned Creating a Caring Economy, and their report is magnificent. And the Care Collective has issued their book, Care Manifesto, The Politics of Interdependence. So we are not at any loss to know what it would take to make a more sustainable system of care possible everywhere in the world. Next slide. But can we go to the next slide? But the care economy requires as well a care politics. It's not enough for us to know what we need to do. We need to be able to convince political leaders that it's time to take these steps. So the plan of my talk is this. I want to zoom out, if you will, and talk not about the kind of really close, granular, in-depth look at the unsustainability of care, which has formed the basis of many of the papers in the conference. But instead, I want to zoom out to a much more global level and introduce an idea, wealth care, to think about a way in which we might be able to win the arguments. So let's begin by talking about wealth care as a way to frame the current political economy. Then I want to talk for some length about why wealth-oriented cultures distort and downplay other values. In other words, to talk about what's wrong with wealth care. Then I want to use the COVID case as a way to illuminate the problem about what's wrong with wealth care. And finally, I'll conclude by arguing that only caring democracy can affect such a valuable change and make care adequate and sustainable. So let's begin as we go to the next slide. Let's begin with wealth care itself. The slides are coming slowly, but here it comes. Harry Frankfurt, a philosopher who you may know for his little short book about bull crap, wrote an essay a long time ago in 1988 called The Importance of What We Care About. And there's something really profound in that title when we think about it. As he pointed out, no theories of ethics really start from this point, but what would happen if we use that as a way of starting how we think about ethics? And I started to think about how might we politically frame what we care about in order to get people to think about the importance of care itself. And I came up with this idea, the way to label this as wealth care. It's not a new idea, but it's a new way of thinking and labeling it. Wealth care, then, is a set of values that posit that the growth of wealth is the central activity, the central value and purpose of society. Society's rewards should go to those who grow and create wealth. Now, in the past, I've used the language of neoliberalism. It doesn't persuade people. They don't know what neoliberalism is unless you're already in a particular worldview. I once had a world-famous economist say to me he didn't have any idea what that term meant. It's not the same as capitalism, because socialists can also be interested in the creation of wealth. And it's not the same as the free market. Although wealthcare is similar to, you'll obviously see, those frames of neoliberalism, capitalism, free market, marketing. Okay, let's go to the next slide. In a longer version of this paper, maybe book, I would argue that wealthcare exists and shapes our political economy, that we're so interested in development, in economic sectors of growth, in the profit motive. And we might think about some of these places: the finance sector, which has grown in importance in recent years in all advanced economies, and even developing economies. The military sector, which still absorbs a tremendous amount of the world's resources. There seems to be, at least in the United States, we can talk about it in this language, a circle of bad food creating illness, creating an unsustainable healthcare system that's trying to fix something that could be fixed if we didn't get sick in the first place from the food we ate. And we need as well to mention the exploitation of the natural economy, which is just ongoing and, as we know, devastating the planet. Now, don't take me to be saying that wealth is bad. Wealth is obviously a good thing. It's better to have wealth, to be able to spend it on things that we need than not. But wealth care as a system of values is unbalanced. Its commitment only to wealth. And at this point in human history, it's extremely dangerous to all of us. So with that, let's go to the next slide. I've introduced you to this idea of wealth care. And now I'm going to argue that wealth care has negative consequences for the world. I want to start by looking at what it means for the wealthy to have wealth care, what it means for the near wealthy, then talk about the way it destroys democratic life, the ways in which it generates and preserves inequality, the ways in which for care it is distorting and damaging. 6, the way it distorts our very capacity to think about responsibility. And finally, to talk very briefly about the way populism feeds into this argument about wealth care. So we'll go through those 7 points now in somewhat greater detail. And let's go to the next slide. So for the wealthy, wealth care depends upon passing wealth on to one's heirs. That's what it means to be wealthy, is that you get to keep that money and spend that money and make possible for others to do this. So it is familistic in a very deep manner. It brings a focus of the state into creating the conditions for the maximizing of wealth. And so the state becomes a source of wealth. Now, we've kind of known this for a long time. Eisenhower said this in the 1950s, that there's a military-industrial complex which has as its job making the state pay for the way the military develops, all the stuff they buy, and so on and so forth. But even the exploitation of the poor in the criminal justice system in the United States, according to some recent work by Joe Soss and his colleagues, shows that the exploitation of state function for the purpose of generating wealth seems to go on in every part of the political economy. So this mythologizes freedom as the free market, as Karl Polanyi, who I'll refer to again later, pointed out already in The Great Transformation. The idea of a self-regulating market is a utopian experiment. The market is not self-regulating. It has tremendous support from the state in directing marketization, say, even of old people's homes in everywhere in the world. So over and over again, what we think of as state functions are actually often state functions being turned to the purposes of wealthcare. When Bill Clinton said in the 1992 presidential campaign, "It's the economy, stupid," what he was really saying is true for really all politicians in all countries. If you're not making the economy better, then you're not going to stay in office, because the people who count on wealth. Next slide. Now, not only do the wealthy manage to capture tremendous amounts of political power, economic power in the world, but it's also the case that the near wealthy are distorted and shaped by wealthcare. In a book published in 2010 called Oligarchy, Jeffrey Winters, who's a comparative politics scholar, wrote about what he called the income defense industry. And what his argument was is this: every society is really an oligarchy. Historically, the Romans were an oligarchy. Sweden is an oligarchy, he argues. But in some oligarchies, the rule of law still prevails, provided that wealth can somehow find a way to protect itself within the framework of the law. And they do this by creating a whole system of mechanisms which allow them to retain their wealth. Most importantly, think about the way taxes are structured, the way international finance is structured, or the ways in which all of these capacities to manage money and move it around the world are being organized by the really wealthy. Now, the people who do this aren't necessarily wealthy themselves, but they are very well compensated for what they do. And what happens then is that this distorts everybody in the society in moving towards not just the wealth itself, but being part of the protection of wealth as a way of maintaining or enhancing one's own economic status. Think of all the people who go off to be accountants because it's going to provide them with a good income. When I taught the students at Hunter College, which is mostly first-generation college students, all of them wanted to be accountants because they thought this would be a way to increase their family status in the future. Now, think of what the growth of the financial sector means in terms of the opportunity costs of all the smart people becoming accountants and hedge fund managers and day traders, rather than using their talents to become doctors, nurses, care workers of other sorts. It really does distort the entire economy, because the people, not only the wealthy, but those who aspire to be wealthy, are also directing their own interests towards the care of wealth. Next slide. The long-term consequence of this is that it is another effect for democracy. Think about it for a moment. The wealthy want to be left in control of the way their wealth is affected by the state. The worst thing for them would be if there were a genuinely democratic movement to take their wealth away from them. And as a result, they are fundamentally and deep down anti-democratic. Nancy MacLean has written about this in her wonderful book, Democracy in Chains, which if you haven't read, I recommend to you. There she talks about how the public choice economics movement began really out of an attempt to limit the capacity of the state to affect not just wealth, but also white supremacy in the United States. And at the beginning of the book, she quotes an historian of that movement, Pierre Lemieux, who says, "The public choice revolution, that is the way we think about economics, rings the death knell of the political we." It was deliberate, this attempt to make it less likely that citizens would engage in political life, and that they would think that only business people know something about the way the world works, and that only business can make us move forward. So this is another consequence of the wealth care strategy. Next slide. Now, it's also obvious that another effect of this is racist and ethnocentric, and has the effect of making it much worse for poor people. Now, there is in the United States, for example, a racial wealth gap that is just stunning in its size. A piece in the Times last week talked about it this way. For every dollar a typical white household has, a black one has 12 cents, a divide that has grown over the last century. Latinos have 21 cents for every dollar of white wealth. Because after all, if wealth is going to stay within families, and if families are able to preserve themselves, they're able to make sure that the people who get wealth are themselves. Now, again, there's an effect of this on the nature of political life and of continuing this cycle of inequality. Because, as scholars have pointed out many times, people with wealth attribute their success to their individual action, qualities, and not to their historical advantage. So if your family has wealth, you don't notice that the reason you're so brilliant and got into a good school is because your family's wealthy. You think you did that on your own. But those poor people who just don't do anything are poor because they lack the qualities of being outstanding humans that you have, largely because of your wealth. And if you try to sort this out, you see it then creates a condition which once again makes it very unlikely that people with a lot of wealth or even people with just a little wealth are going to be interested in trying to change how this inequality comes into existence and continues to perpetuate itself. So this is yet another harm of wealthcare. Let's go to the next slide and turn to the question of care. Now, care is a very strange thing from the standpoint of wealth care. Anything that doesn't create wealth has historically been left out of the economy and treated, as Marx put it, as a gift of nature, raw materials. Also, care, which again in the Marxist tradition is referred to as social reproduction. But care is, as we all know, a relatively expensive way of making a relatively expensive human activity. The way that human activities become more wealth generating is by creating greater efficiencies. And it's really hard to create greater efficiency when you actually are doing hands-on care. So as a result, for the most part, care has been left out of the wealth care system and shunted off to places where it won't affect the creation of wealth. Most importantly, this is to the private family, which has remained the locus of care within wealth care systems. Now, but family structure itself is also changing under the conditions of non-wealth and precarity, and this is making care even less sustainable. Marriage now is only for the well-to-do in the United States. Virtually the only people who are getting married in the United States are people who are two college-educated people marrying each other. Otherwise, mostly what people who are poor are doing is consolidating debt. And rather than get married and entail all the legal complications of that, rather than share their debt with this man or this woman who may not last for very long, people are, in fact, not using marriage as an institution. This isn't true only in minority communities, but across the board. Children are increasingly becoming thought of as, this is the language that's used, an investment. And if you think of children that way, whether or not you're willing to invest in your children, you could see how wealth has completely controlled or begun to dominate the way we talk about these things. And because care is too expensive, care relations and employment is exploitatively organized. In the important work that Lydia Hayes did, looking at home help workers in the UK, she noted that over and over again, despite the legal protections that are in place to make sure that those folks are adequately paid, they are not. They're constantly getting ripped off and cheated. And that seems to be part of the structure of the system itself. And we know that from all the work we've done on how caregivers are treated, that seems to be the case almost everywhere. Not everywhere, but almost everywhere. And it seems to be part of the very structure of the system itself. Next slide. The next slide takes us back to a slightly more philosophical level, if you'll let me do that. But it talks about the ways in which it's very hard to generate any role for citizenship or collective responsibility once we move to this conception of wealthcare. Karl Polanyi in The Great Transformation talks about it, that once freedom is thought of as an economic activity, it ends up casting aside all forms of what he calls compulsion on the part of the state, unquote. Once people think of themselves as merely producers or consumers, they really no longer think of themselves as citizens. And a person then, he says, bears no responsibility for, quote, the economic suffering in society from which he personally had not benefited, unquote. So the fact that some people are poor and some people don't have homes and some people don't have in U.S. healthcare and in other places don't have other kinds of very basic social provision, food, those things are not my fault because I didn't do it. What Polanyi points out is such a person came to view himself as outside of politics and those economically produced structures of inequality. And what becomes more, quote, he denied their reality in the name of his freedom. Rather than admit that those things are a result of some of the actions that you've taken, it's easier for people to say, those things don't even exist. They're not even there. If they're poor people, it's because they haven't eaten enough or because they didn't work hard enough. But I have nothing to do with the fact that some people have no wealth or have no food. Next slide, please. Now, I have argued elsewhere, and Sue has heard this argument, and the people at Sheffield have heard this argument before, that the neoliberal promise that free markets will generate wealth and all will be well has turned out to be a lie. And this has led to the rise of anti-democratic forces because these policies fail people in their daily lives. Right-wing neo-populists can be thought of as racist and distrustful of outsiders and as masculinist, and all those things are true. But another way to understand them is that they are offering themselves a really, what I would call perverted way of thinking about care. If you think that you've been abandoned by the state, then the idea that I must protect my own and I must define my own reality to know what that's going to look like begins to seem like a plausible way to approach the world. And so this pernicious neo-populism that we see all around the world, religious revivals that are destructive towards other religions, authoritarian states, the rise of Trumpism, all of those ideas fit with a world in which, because you can't figure out how it is, since you believe in wealth, that the world has failed you, you have to come up with some other explanation. And the explanation you come up with is, I don't know, I don't care, but I'm just going to take care of my own people, my own family, my own self. And you turn into a person who is more distrustful of others, masculinist, racist, familial, and so on. We've seen this happen around the world. Next slide. So to summarize, wealth-oriented cultures distort and downplay other values. They make it very difficult to be inclusive because they divide people by class, by patriarchal family structures, by race, by ethnicity, by nationality, and so on. Responsibility becomes narrowed, so you think about it only of yourself, and it becomes a weapon against others who, by the very fact that they don't have wealth, must be irresponsible. And so we're caught in a cycle in which people are extraordinarily distrustful of one another and in a situation where the idea of social cooperation or of political collective action become very difficult to sustain. And it was at this point that the COVID-19 virus, that the coronavirus emerged. So let's go to the next slide. Because now I want to talk about the ways in which, if we understand wealthcare this way, we see the responses to the pandemic slightly differently. Next slide. One of the first things that happened with the pandemic was that some people were able to retreat away from the danger and other people were caught in the danger. And guess who was caught in the danger? Were the people who are essential workers. Healthcare workers, including everyone involved in hospitals and care facilities, home health aides, providers of food and essential supplies, delivery people. Those are the people who ended up being most at risk and, frankly, the most affected by the disease. Next slide, at least thus far. Let's go to the next slide. So the essential workers, at the next slide, and healthcare workers bear the most risk, but are often the ones who are least well paid. And as they see it, they are often not cared for. Indeed, in the Care Manifesto, there's a lovely discussion of the idea of care washing, the ways in which companies are using the rhetoric of care to make themselves look better in the crisis. But the realities, next slide, the realities are really dire. For women, as we know, more women have left the labor market. In the US, a decade of progress has been lost. Moving home has meant that more women had to perform much more domestic labor. This is really well documented at this point in the literature. Levels of domestic violence have increased everywhere in the world. But it's not just women, it's also poor men who have been affected by this. Poor workers have been forced out of the workforce more quickly, their recovery is slower, and precarity follows them every step of the way. People who had wealth were able to use their wealth and even to save some money because they weren't spending so much. But for the poor, things have become even more dire. Next slide. We know for care workers that care work is, the care conditions of precarious workers actually made the pandemic worse. In nursing homes, the fact that if you're a nursing home worker, you can't live on one salary, you had to work in several jobs, meant that you might in fact be spreading the disease as you went from nursing home job to nursing home job. Nancy Fulbright talked about the fact that at the beginning there was some talk about hazard pay for essential workers, but you'll notice that that idea has not lasted very long at all. So the brunt of the suffering at work, the exposure to the disease, is borne by care workers and poorly paid essential care workers. Now, that's bad in and of itself, but there's another side to the wealth care piece here. Next slide, and that is that wealth care has warped the pandemic response. This is kind of mind-boggling, but wealth has grown exponentially during the pandemic while people have been suffering. There's a little data there from the Institute for Policy Studies about how the wealth of US billionaires has grown $831 billion in the first 7 months of the pandemic. So what's interesting is as people are dying of a disease which we don't have a cure for, but we do finally have a vaccine for, the wealthy people were just making and piling in more and more money. So why wasn't there enough PPE? Why is it that things as simple as face masks weren't available for healthcare workers at the beginning of this pandemic? It's because there is an extraordinary bias in the healthcare system. In the slide references, you'll see a reference to Prasad and Prasad's law. And Prasad's law makes the argument that there's not enough nurses ever in a hospital. There are never enough people to do the work because investment in healthcare and the healthcare field favors devices and drugs because you can make a profit off of those, whereas you can't make a profit off of the workers. Okay, so it's not peer-reviewed, and I'm not sure if I'm convinced by Prasad, but I think the argument may, in fact, carry some validity. The ventilator situation was critical. I mean, a year ago in New York, where I'm living, we were desperate to count the number of ventilators in all the state hospitals, in all the national hospitals in the United States. Where would more ventilators come from? But it turns out that some years ago, one of the major manufacturers of ventilators got a government contract from the United States government to produce ventilators that were inexpensive to produce, inexpensive to use, simple to use. What happened to those ventilators? Another ventilator company that produces the big, expensive machines bought them out and killed off the project because it wouldn't generate as much money as the large ventilators. So this kind of distorted reality of using wealth as the way to make decisions about how to make provision for healthcare are stories that are layered everywhere through the COVID-19 response. Next slide. Okay, I admit it, I'm vaccinated, fully vaccinated. Here I sit in the most privileged place in the world, and I've been vaccinated. But vaccines are disproportionately available in higher income countries. As you know, in some poorer countries, no vaccines are available at all. Let's go to the next slide, which kind of serves as a summary or the beginning of a summary for this part of the talk. There was an article published in the British Medical Journal earlier this year in January that made this nice claim. The burden of COVID-19 follows extraction patterns from colonial times, with the worst outcomes suffered by marginalized people and poorer countries. As Bump put it, they are extractive, repressive, and competitive. That's what the COVID-19 political economy is about. And for the first time since 1990, global poverty rose last year. So this has been a disaster from the standpoint of the concentration of wealth even more, and of using wealth to make decisions which harms people. Next slide. Now, some people are a little optimistic because there is some evidence that some of these concerns are being addressed. Often it comes in the form of disregarding care and expecting that a care worker will still go on. Let me give you an example from last week. Cura Italia is the directive of the Italian government, which provided money to give people money who had lost their jobs because of COVID. But it excluded home care workers. It's kind of extraordinary that after all of this, nobody would think about the fact that home care workers are among the people who need to be supported if you're going to take care of people who are sick at home. The COVAX WHO project to share vaccinations is an illustration of people in the higher income countries trying to do right by saying, we're going to share the extra doses of vaccine we have. But this idea that after we've taken care of ourselves, we're going to help you other people is really indicative of another piece of the wealth care story that I think is important for us to recognize. And so the next slide, and I'll stop talking about wealth care after this. Another way to characterize wealth care is that it is, to use John Stuart Mill's language, an injustice in itself. So Brooke Ackerley, in her wonderful book, Just Responsibility, A Human Rights Theory of Global Justice, published in 2018 by Oxford, looked back to John Stuart Mill and found this great passage. The great error of reformers and philanthropists is, quote, to nibble at the consequences of unjust power instead of redressing the injustice in itself, unquote. Doesn't that kind of summarize the way the world has responded to COVID? Nibble at the consequences of unjust power instead of redressing the injustice in itself. Now, Brooke goes on to talk about the fact that injustice itself is a power relation, not merely a consequence of a power relation. That's what injustice itself is. And the workings of injustice itself become self-concealing. And so we don't see wealth care as a system. We don't see that our deference to business is a way in which we end up supporting this injustice in itself. In my last couple of minutes here, then, let me make what you expect from me an argument, quote, let's go on to the next slide, that only caring democracy can, in the end, make care sustainable. Next slide. You all know probably what I mean by caring democracy. The great democratic revolution remains incomplete. It leaves behind those who are still associated with the work of the household, whether they do it in the household or in those poorly organized, poorly paid sectors of the economy that we call care. And just as incorporating workers, the big democratic reform of the late 19th, early 20th century demanded a change in the scope of democratic concerns, so incorporating women and marginal people, usually in the household, requires a similar transformation in the issues and concerns of democracy itself. Next slide. This is what I call then caring democracy. And there are three main elements of it. First, we have to redefine democracy itself as a way to allocate caring responsibilities in a society in a just way. Second, that we need to reorganize caring responsibilities because some currently can avoid or deflect caring responsibilities and others get left holding a much larger, huge burden of caring responsibilities. And thirdly, that we have to use democratic means to arrive at these caring solutions. Look, care is often not about equality. In ongoing daily relations of care, we're not really usually looking at equality. But we need for citizens to learn how to practice care democratically and make sure that all voices are incorporated when we try to think about democratic care. If only the wealthy have access to political corridors of power, then their version of care, somebody poor should take care of me for not very much money, is going to persist. It's only when the voices of those who have been excluded are also going to be included about what their care needs are that things will begin to change. So, next slide. Democratic care requires that we rethink inclusion, and it requires that we rethink responsibility. Next slide. Now, let me go back to where I started, which is I think that this is a kind of political argument that we can effect in the world, because care is familiar. And this familiarity of care can make a contrast to wealth care. We can, if we begin to talk about wealth as a kind of distorted care, make it clear why it is better if people are interested in what happens to their daily lives. Look, most people show very little interest in care, in politics at the present moment. Most people don't follow politics. They don't follow any of things that are going on. And we might ask the question, who benefits from the fact that most citizens, the vast majority of people, don't follow political life? I think using the language of care to discuss politics changes its relevance and brings it home to people in a way that, say, the pandemic really has brought home the way in which politics is involved, comes home to people. So only a broad democratic movement, let's go on to the next slide, please. Only a broad democratic movement for change can undo wealth care. Margaret Thatcher, remember, said there is no alternative to neoliberal economics, to small government, to the triumph of wealth care. But you know what? I think people think there is an alternative now. Instead, what we need to see is care everywhere. Among the interesting places where care language is beginning to crop up is in an analysis of the Black Lives Matter movement in the United States and around the world. Diva Woodley, who's a political theorist, argues, for example, that Black Lives Matter is a movement for care. It is a claim about what matters. And it is the kind of claim that we can get people to see, understand, and then recognize where we need to make larger changes in the world. Next slide. So the hope for caring democracy is that we are at a moment when there's a possibility for great change. Look, we can recite already the steps that it would take to make basic care better, more equitable, and more fair. It begins with providing adequate support to care workers, providing for their basic needs, for their abilities to care for their families. But care also exceeds the ability of families to provide care. So better education, health care, public transit, food systems, affordable housing are also necessary. Social values need to be attuned to basic needs and their care, not to wealth care. But the injustice of wealth care creates a system which cannot end without political change as well. And to make these arguments in face of the entrenched injustice in itself seems at some level to be to whistle in the wind, because the logic of wealth care makes any proposal that seems to diminish wealth a non-starter. So while a movement needs to be built, political leaders taking steps in the right direction always open possibilities. And to me, the most optimistic thing that's happened in the last year is that people have been thinking about perhaps ways to make changes. These steps will reveal the ongoing inadequacy of care without democracy, and they may then create the conditions for a movement for care and democracy. So, if that could happen, then perhaps there's a brighter end to this horrifying human tragedy that we're living through. Thank you.
Thank you so much, Joan, and thank you for that powerful but sobering conclusion to your fascinating speech. I think it's really important for us to think very carefully about care in the context of wider political and economic framings, and not to become so internal to care in our research and our theorizing that we don't lift our heads up and see what perhaps might be the driving forces that are making it so hard to change the conditions of care. I'm going to open the floor in a moment, but that means people need to write something into the chat or and to either ask a question or to make a point or add a comment. And this is a bit unfamiliar for some people using this platform, because we're used to raising our hands and then being invited to speak when we're in a lecture room or in a keynote lecture theatre. So please, can I encourage you who are on the call to ask a question. Joan, I'm sure, will be very happy to answer them, and to think about what you might want to say in response to the important ideas that Joan's just shared with us. I want to start the ball rolling a bit, Joan, with asking you to say a little bit more about what you mean when you're talking about rethinking responsibility. I'm conscious that, during my career, and I'm sure yours as well, we've seen phases in which we've become very familiar with the idea some decades ago about blaming the victim. We've become familiar with the concept of responsibilization, in which responsibility as a concept is subverted to another end, in which the person who is struggling to manage is told that they need to take more responsibility for themselves, and that if they did that, then their life wouldn't be so difficult. And so I wondered if you could say what you mean a bit by how we could rethink responsibility, and where perhaps we might start in our conversations with others who don't currently think care is very important, because everyone in this audience probably does think that, but we know we're in a minority. Most people don't think about care at all until a caring responsibility lands upon them or a caring problem pops up in their life, and then they realise, hey, this is quite a difficult problem to solve. So could you say a bit about responsibility?
Sure. So as you know, I think responsibility is one of the key elements of care. We are constantly assigning responsibility to others or taking responsibility on. And this idea of responsibilization is a nice illustration of what I mean by what wealth care entails. What frequently happens is that I've noticed this everywhere in listening to discussions about new initiatives, say, for inclusion in a university or a health care system. So then you ask the question, well, what resources are provided for this new inclusive approach? Now we're going to talk about or look at racial disparities in our healthcare system. Guess who gets stuck doing the research? Guess who gets stuck doing the work of calling the committee meetings and pulling people together and trying to make things happen? The people who get stuck with that are the people who are interested in the problem in the first place. No additional resources are provided, and people end up trying to take on yet another task as they're doing their ongoing work. So that's, you're quite right that responsibility has to be, this is a key piece. Responsibility isn't only taking on new responsibilities, it's also refusing or returning responsibilities to those who don't take on enough. In households, typically some people do most of the care work and other people do little of the care work. And what we've discovered in the pandemic is universally that men have taken up a little bit more of the responsibility, but tremendous amounts more of responsibility have passed on to women. Now, we need to have democratic discussions where people actually start and say, let's think about what responsibilities, what care work is getting done, who's doing it, and how do we justify that division? This needs to happen in all of our institutions, families, work settings, and so on.
Yeah, I feel that work is an area where we can get some purchase. I think paid work, has been a focus of political solidarities and political demands for many centuries. It's been something we've fought over in the past around, a reasonable working week, protections at work, health and safety at work. All of these issues have been politically moved forward, even if not to the to the true satisfaction of all the problems that we would hope they would resolve. But it does seem to me that it's about the organisation of paid work and what we consider to be labour market work that we also need to ask some big questions about whether the other changes that are going on. But the pandemics, as you said, is this stress test that we've been through, and it's also a kind of a microscope that we've put ourselves under, and we're all looking at things a bit differently from how we are before, and perhaps magnifying the things that we're looking at a bit more. But are there some other issues that we need to also be sort of bringing into our remit, like the opportunity that might be arising through some of the other transformations that we're going to be seeing in the way work is organised? Because we're told by other thinkers that we can anticipate, and we've heard this before, of course, much more leisure and much more scarcity of work. Are those changes also going to affect us, do you think? While you're responding to that, I'm going to let Janet Fast know that I'm going to ask her question next, and if there are more questions to come into the chat, please put them into the system. So Joan, would you like to respond to those points?
Yeah, I think you're right that it's in paid work that we've done a lot of this, but again, paid work is really complex because of the hierarchical organization of most of the agencies within which we do paid work. And we kind of become familiar with the ecosystem in which we're operating. The New York Times on Sunday morning runs a column where they follow somebody around. How do you spend your Sunday morning? And during the pandemic, usually it's some actor who goes out and gets coffee, and it's really not that interesting. But during the pandemic, they also covered a woman who works as a home health aide. Well, I work until midnight at this job, and then I get on the bus because the subway isn't running anymore in New York overnight. And I get home about 4 o'clock in the morning, and I sleep till 6, and then I get up and take care of my kids, and then I get up to go to my other job. And that's how this woman lives her life. Now, she clearly has too much care responsibility, and other people don't have enough. And so the question is, those are two different paid work situations, right? Or think about the person who works at Google, where they can pick up all their food, drop off their dry cleaning, and basically have their lives, all of their care work, their own personal care work, taken care of by their employer. And they get paid an enormous salary. People who are actually doing the the really dirty jobs get none of these provisions. So in paid work, those disparities have surfaced, and we need to keep talking about them. But I also think that there isn't going to be more leisure and more scarcity of work. I know people keep talking about this, but what I see is more people groveling for really small amounts of work. So as work becomes more scarce, it's not that it's getting better paid or better compensated, it's getting worse paid and worse compensated. The delivery people who drive around New York on their electric bikes are exhausted. And at tremendous risk, they are often robbed of what they've earned and of their bicycles on a daily basis or a weekly basis. Those kinds of inequities need to be addressed. And you know, it's as work becomes more fragmented, it's harder to find the locus of where you would begin to start that conversation. So that's part of the problem of focusing only on paid work. Yeah.
Thanks. I think that's some important food for thought. Janet Fast from University of Alberta in Canada has asked you to comment on how optimistic you are that this opportunity, I think she means the pandemic, for great change will actually lead to great change. If those with the most to gain from such change have been exhausted by the consequences of the pandemic, where are they to get the resources to lead change?
It's always the case that those who are the most exhausted are the ones who need the most resources and don't have them. You know, I am a little bit optimistic because there's kind of a crack in the way the world has been organized. And my inspiration here are Francis Fox Piven and Richard Cloward, who in their book Poor People's Movements wrote about the fact that change doesn't happen when people are oppressed. Change happens when it looks as if there's some possibility for change, because somehow the system is cracked open. And we're living in a moment when it looks as if the system has cracked open. We haven't yet captured, but this is what I think wealthcare helps us to do. We haven't yet reached a moment where we've captured how it is we want to effect the change. But I think the other thing that's going to do this is the environmental issues that we're facing. Climate change is a piece of it, but the destruction of species, the ways in which the oceans are being affected, all of this leads us to recognize that human activity, the generation of wealth as the singular pursuit of all humans, is a really stupid idea at this point. And caring for one another, caring for the animals and the plants and the world around us is a way to change this. So people are exhausted, but people generate energy out of working together for change when it looks as if change is possible. And so I'm a little optimistic, I guess I would say.
Thanks, Joan. And I would also add my own perspective is that there's some hope for, or some optimism can be taken from the commonality of this experience around the world, that, you know, that this pandemic is affecting people in rich and poor countries, that we can see the need for some international action, and that would be a more valuable way of finding an exit from the pandemic, but also that we could find some ways of addressing some of the care challenges that we face, because as you've written about in your other work, and as we've spoken about a lot in the conference over the last couple of weeks, the caring labour that is most exploited in our current arrangements is that which is caring labour that is taken from one part of the world and re-implanted in another. And so I think there's some issues there around working with institutional international institutions and with frameworks that promote universal standards that are something we could really think about. I've got a question for you from Professor Teppo Kroger in Finland. Teppo says, we here in the Nordics live in a kind of caring democracy, the Nordic welfare model being the key concept, but still other needs become prioritized when resources are divided. How to argue for a change? So how do you cheer up the Nordics, who for so many decades we've looked to across my career, we've looked to the Nordic welfare model as something to emulate, and we see it under pressure now and changing. What do you have any words of encouragement for Teppo?
Follow the money, because in the Nordic states as well, there is a culture of wealthcare, which has become more ingrained. And it really takes us back to this question of whether or not just more is what people need. And I think the people in the Nordic countries are more aware of why this is an important question to ask. But even you all haven't yet achieved an answer to that question that gets us past some of this. The work of Hannah Marlene Dahl, which looks at the ways in which in elder care, the language of neoliberal management has kind of infected what is happening in all of the Nordic states, I think is really important to look at, because as much as there's been a welfare state, there's still a wealth care system, and care for the wealth still gets a lot of the important attention in even the Nordic states. I was really shocked when I read Jeffrey Winter's book the first time, and he makes the case that Sweden is an oligarchy. I wouldn't have called Sweden an oligarchy for anything, but he does, and I think his evidence is persuasive. So this is the kind of argument I think that could even work in the Nordic states.
Thank you, Joan. We've got a question coming in from Hildegard Theobald, who is based in Germany. And she asks, what is or could be the role of social policies in redefining care responsibilities in society, or, for example, to change conditions in care work? So what do you see as the scope for social policies?
Yeah, that's a good question. It's not one I've thought about very directly, because, of course, I live in a place where social policy, the language doesn't even track. And forgive me for not being more broad-minded to have thought about this question a little more. But I do think social policies can help us redefine care responsibilities in society as a whole. For at the very least, we could talk about the fact that people whose daily care needs are met through their economic conditions might want to share some of their economic advantage with people for whom even meeting the daily concerns of living, getting enough food, clothing, shelter, are difficult. And so in housing policy, in food policy, in unemployment insurance, all of those areas are areas where we could talk about a redefining of care responsibilities. The conditions of care work can be changed, and really there have been very careful, detailed proposals made by the people in the UK, in Germany, in Spain, all over, about what those would look like. There was that slide at the beginning. The slides will be available to you all. There was a slide at the beginning where you can read all those reports that show that the really good ideas about how to do this are already kind of out there. Yeah, let me.
Okay, I've got another question that's from Bapaya Perry, who is a postdoctoral scholar at the University of Trinidad and Tobago. Bapaya's been avidly following the conference, and we've enjoyed her contributions to many of the debating and Q&A sessions that we've had. And she says, where do you see there being clashes between the principles of neoliberalism and a care democracy? How do we navigate these clashes?
Yeah, well, Thank you. Neoliberalism is by its nature a denial of collective or social responsibility. No, it's so fascinating. When I read Margaret Thatcher's statement, "There is no such thing as society," I thought, what a weird thing to say. And then when I went back and reread Karl Polanyi and that passage that I referred to about responsibility, if you want to look at the great transformation that's in the last chapter, where he says, if people only think of themselves in economic terms, they can't possibly imagine what kind of responsibility they have towards others, or that they may have some bearing on others' lives. And so their freedom requires them to deny the experience and reality of those others. To me, that's really the key point at which neoliberalism and caring democracy differ. Because caring democracy says everybody cares, everybody gets cared for, everybody needs to be engaged in the ongoing processes of care in society. And care has no way of tracking within a neoliberal system except I'm taking care of my family or I'm making money from care, one way or the other, or I'm paying for care. So there's that contrast. It's kind of a contrast between an economistic view of the world and a world that views us as social and political creatures who are kind of muddling through together and need to make some provision with and for each other. Maybe that helps.
Thank you, Joan. Any of you who have asked questions and have heard what Joan's had to say, you're welcome to come back with a further comment if you wish. I wanted to pick up what you were saying a moment ago in response to Hildegard's question, Joan, and you mentioned food policy. And I think what's been quite striking in the UK, and I don't know whether this has happened elsewhere, but a big issue sort of burst upon into the mass media, into the political reporting, into social media and our newspapers last summer, which was about food poverty. It was about the children not having enough to eat in poor families and going hungry during the school holidays because they wouldn't be getting their meals at school. And this became a really sort of cause célèbre for a brief moment, and we wait to see if it has further repercussions. But it arose at the same time as in our team, and this work was led by Matt Bennett and done with our colleague Yanan Zhang, and they looked at food bank use by people who are unpaid carers, and they found that food bank use amongst that group of the population was significantly higher than it was amongst others in the population. And we use this to generate some purchase around thinking about people who are providing unpaid care and doing a lot of it. And I think in the discussion so far in relation to your talk, we've spoken quite a bit about those who become wealthy, and we've talked about those who are doing a lot of the paid work of care. But we also know that the distribution of unpaid care work is very, very unequal and is concentrated in certain population groups and people with certain characteristics, particularly, of course, women. But I wondered if there's some way that we can also talk about unpaid caring and value what it brings to people who, and we know from our research on unpaid carers that many people say how important it has been to them to provide care for their dying mother, their husband with chronic sickness. It's brought something to their life, that they have a disabled child that they can give care for and see value in that person's life. But somehow that doesn't get beyond them. You know, we don't seem to be attracting people to want to see care as something important in their lives. And I wondered if there is something we should be doing to change the mindset of people who don't think about care much, you know, and about how we might recognise that lots of unpaid caring is done very selflessly and very altruistically, but that's not distributed in a way which is fair across society, and we're encouraged to think about alternatives to it whenever those are financially possible.
Yeah, this is a hard question. It takes us back to the question of charity, in a way, too. It's a hard question to answer, Sue, because it's certainly the case that, okay, food bank use is up tremendously, and yeah, in the U.S. too, people are going hungry. There's no denying it. And people do feel when they've done the care work themselves that it's very valuable. So Arthur Klein, who's a professor at Harvard, just wrote a book about caring for his wife and how moving and important it was. And gosh, everybody should realize this is really important in their lives. I'm a little impatient with that argument because, yeah, okay, right. And everybody, it's also hard work. And not everyone has the resources you had to do it. But the thing that's interesting to me is that it doesn't bring others to it, in part because it is particular, and in part because we make it into something unexpected or exotic or outside of normal life. That's the key here, right? It's not what's normal. But the truth of the matter is, it is what's normal. Every day, all of us are at the very least taking care of ourselves. Now, we're either doing it well or poorly, or as well as we'd like, or not as well as we'd like. And under those conditions, if we started to think about the systemic ways in which that translates into our relations with others, then we're beginning to make change. But you're right, it's very difficult to go from something like how unpaid care workers are the ones who show up at the food banks because they're the ones who realize how close to the bottom they are and they have to go and take food, versus people who perhaps wouldn't do that. That's a really, it seems as if those two worlds are very far apart when in fact they're really not very far apart at all. And I don't know how to convince people otherwise. If I did, that's what I'd be doing. But I'm not really sure how to do that.
Yeah, it's an interesting point. I mean, it does seem to me that there is potential for care and the need for care at some point in life to be one of those great levelers in society. Yes. We all will have one day to face some degree of frailty. Very likely, very few people have a sudden death without any need for care. It's a common experience to need to rely on others, to need to have support, to need to be looked after, sometimes to experience bodily frailty. I think all of that, and of course increasingly mental frailty. And I think these are issues that we could try to find a way of using to unite us. But of course, it's very often something that people are encouraged still, I think, to feel some shame about or to hide behind closed doors when those things happen. And I think that's another area where some of the movement around the care of people with dementia, I think, is quite inspiring. I think I know that it has its flaws, but the Japanese system of trying to spread awareness about dementia throughout society. I remember being in Japan and hearing about how all the police have been trained in it, and all the school teachers were being trained in it, and there was a really concerted effort to get everyone to understand what is dementia and how can we encourage people with dementia to still be participating in society and joining in the life of the rest of the society without being excluded. And that seemed to me that there are some inspiring ideas that have had some traction in some parts of the world, which we can all learn from. Joan, we've got a question from Maria Cheshire-Allen. Maria is at the University of Swansea in Wales, and she asks, how can we capitalise on what she quotes, the common experience of the pandemic and the shared need for care to challenge the negative burden discourse that is so often associated with care, particularly care of older people?
Yeah,
another hard one.
Framing the question that way, you kind of answered it, right? That it is difficult to go from a common experience to think about the fact that often once you stop thinking about we are the world, it gets very difficult, and often the burden is a difficult and negative one. And those are the associations that we often think of. I want to and this is partly an answer to Sue too, and then I'll come back to your question more directly. It's not only that we will have the experience of needing care, we have all already had the experience as infants and children of needing tremendous amounts of care. And as children, providing care that was probably really bad. Not telling your parents you got a bad grade because you didn't want to upset them is a form of childlike care, right? And I think if we started to, again, use the language of care more to talk about what it is we've done as we've reached the level of maturity, whatever that is, that we have, it would be useful for us to kind of, again, make care more normal. The negative burden associated with care, particularly care of the elderly people, has to do with, of course, the fact that older people are and this is a difference between caring for children and caring for older people. Older people are facing death and human mortality, which is a very difficult thing for us in our culture to face, in large part because we're always thinking about growth and more and wealth and more and progress and more. And so death is kind of a difficult thing for us to deal with. I think that, so Maria, one of the ways I would answer this, if you don't mind my calling you by your first name, is that I would try to think about the ways in which part of the common experience of the pandemic is about the ways in which we may change the way we think about death. That coming to death in a caring way is an important part of this common experience. I mean, if you read a lot of the testimonies of the medical workers, what they've said is that they didn't want anyone to die alone. And that's hard to do if it's your very annoying adult, your mother, your father, the person you've cared for, who is the one who's facing death now. That does become a burden. In general, the way to make burdens lighter is to share them. Mm-hmm. And if we can, again, if we recognize the ways in which it is a burden, if we're willing to say that out loud, then we can also begin, again, to go back to the question that Hildegard Theobald raised. We can think of social policies where it isn't a burden that any one person bears so directly. The more you share that burden, the easier it becomes. And so what we have to do is really kind of start thinking about what we would do as a society to share the burden of coping with the burden and the joys, frankly, of coping with people who are older and who are more frail. You know, not every culture thinks of old people as burdens. Most cultures in the history of the world, it seems, thought of older people as providing experience and wisdom and insight. And somehow we've lost that capacity. And again, it has to do with the time squeeze that care has become. But that might be another way for us to think about, so through thinking about death more systematically, thinking about time more systematically, this common experience may be able to become a way to move us away from that discourse about the negative burden of older people.
Thank you, Joan. And thank you so much for giving us such valuable food for thought as we progress through our 3-week-long conference online. We would have loved to have welcomed you to the University of Sheffield to give this keynote talk and to sit down with you afterwards over a glass of wine or a meal to talk further about this. But of course, we cannot do this in this situation. But we are very grateful to you for agreeing to do an online keynote for us. I want to thank you for getting us to think about normalizing care, for encouraging us to call out wealth care for what it is and the damage it causes, which I think is an important and radical thought which needs to be discussed more widely. And thank you for bringing that into the conference. I thank you also for helping us to think about some of the ways in which we might connect the care and environmental, excuse me, so sorry about that. Right, that was actually my timer for some reason. But thinking about connecting care and environmental challenges, and I think there is some momentum there. Also thinking about the moment around Black Lives Matter, the important issues that are raised in countries. We were hearing earlier today about the way that Maori culture has informed New Zealand's approach to well-being and the way it's thought about both family and care in different ways through that experience, and to think about how we might share burdens and support those who are providing care through our social and other policies. And I think there's a really important set of challenges there for us all to think about. Well, where does my research, where does the evidence that I've collected, where does the thinking that I've been doing contribute to this movement for change that I think is so vital, that we need to move towards much better arrangements for care, much fairer arrangements. And your arguments about caring democracy and your insight in helping us to see some of the aspects of the political economy of care in a sharper light, I think, are really, really very valuable. So I'd like to thank you for your contribution. I'd like to thank you for spending time and for your patience in coming back to talk to us this week when we had a technical problem last week. And I'd like to thank everyone who's asked questions and who's put comments into the chat for their contribution. So Joan, thank you so much. Thank you for all you do to bring care to the attention of the world. We've been privileged to have you as our keynote speaker, and we thank you very much and wish you very well as you continue in New York, in not the easiest of places to be living at the moment, through this difficult pandemic. And thank you to everyone who's contributed and who's joined the lecture online. Thank you very much indeed.
Thank you, Sue.